Hello friends, welcome back to RD Plastic Surgery channel. Today we are presenting lip reduction. These are the lips which the person feels that is more in disproportion to upper lip, or the person doesn't like it. In this case, the person feels that the large lip runs in their families and she wants it reduced to the normal or to the to her wish. Normally the ratio between the upper and the lower lip is 1 is 0.6. In other words, lower lips are always bigger than the upper lips, and due to the aging, the upper lip thins and lower lip protrudes. But here we have a young woman, and we have a long-term follow-up of this patient. In other words, we want to that after the surgery we have followed this patient up to 3 years and found that it was in her life when the lip is open like and closed, and do the marking, and then again do the marking when she feels the lip is ideal. So you have a template for how much is to be reduced, and then as a technical person or a person who is dealing with the lips, you try to find out whether it suits our face or not. That's the only thing you will like to have, that you don't fall into the desire of a person to overcorrect, undercorrect, or badly correct. So it's always better to be a slightly undercorrection if you feel that it is getting overcorrected, because you can always reduce, but to augment is a bit more difficult. So we marked it, we assessed the psychological person that the patient is not suffering from the dysmorphic syndrome, that every part of the body is not in proportion and every part should be reshaped. The person was very stable and wanted only the lip because it runs in their family. So the problem is right from the childhood. After resecting it, we waited for 6 months for her assessment because the edema and immediate swelling does occur, and she was happy. And then we again met 3 years later and again reassessed her whether it was stable or whether the desire of resection was over simply because she wanted her resected, and it doesn't matter now what it is. But we found that. कैसा लगता है 3 साल बाद हम मिल रहे हैं और हम आपके जानना चाहते हैं कि लिप सर्जरी के 3 साल बाद आपको ठीक लग रहा है कि आपके लिप आपकी सेटिस्फैक्शन के हिसाब से ठीक है?
जी सर, मुझे सही लग रहा है।
सही लग रहा है
जी सर।
हाँ, और वजह ये थी कि आपके खानदान में रन कर रहा है कि सभी के मोटे थे, नॉर्मल से थोड़े से मोटे हैं।
मेल के ज़्यादा हैं बट फीमेल में तो 1-2 ही हैं, तो मेरे को ज़्यादा लगता था।
और आपने ये डिसीजन लिया कि मुझे थोड़ा सर्जरी करानी है, और उसके बाद आपको कभी ऐसा तो लगेगा कि सर्जरी उतनी अच्छे रिजल्ट नहीं दे पाई, या आपको लगता है कि जो आपने चाहा वो मिला?
जो चाहा वो मिला।
आप सेटिस्फाइड हैं?
यस।